All right, Dr. Thomas, you are all set to go.
All right.
Welcome.
And would you like me to just get started, Brianna?
Yes, please. If you could just
Okay.
introduce yourself quickly, that would be awesome.
All right. Good morning, everybody. My name is Dr. Donald Thomas. I'm a rheumatologist in Greenbelt, Maryland, just right on top of Washington, D.C. I specialize in treating patients with lupus, and my passion is educating lupus patients on how to take better care of themselves. And this is because there's so much more to doing well with lupus other than just taking the medications. I have over 200 lupus patients. Most of my patients are in remission or low disease activity. The vast majority are on no steroids, and it's because most of them do the things that I recommend. So I hope to be able to share some of that great information with you today. And I promise, if you do the things I recommend today, you will do better with your lupus than if you didn't. So let's go ahead and get started. So first, I'd like to tell you about a patient of mine. This patient is named Betty. And let me get my screen up. There you go. So Betty, she's a wonderful woman. She was being treated by another rheumatologist, and she came to me around 2015. And she really had severe lupus that was not under control. She was tried on multiple medicines, and she was miserable. She was especially miserable because the lupus attacked her joints. It caused this horrible problem called Yaku's arthropathy, which caused her joints to become very deformed. And she had great difficulty doing things, but she also had active rashes, sores in her mouth, and her fatigue was just horrible. Well, I knew that she had active lupus because one of the things we use in our practice is ultrasound. I actually put the ultrasound machine on her hands, and I could see what her tendons looked like underneath the using something called Doppler ultrasound. And I'll show you what I'm looking at. If you notice here, up here, this is the skin of her joints. And by the way, my screen is over here. That's why I keep looking over here. But this is one of the tendons that's being damaged by her lupus. You can see these linear lines here that tell us that it's a tendon. And then this white area right here, that's the sheath around the tendon. And then there's another sheath on top. And right here, you can actually see swelling around the tendon with active inflammation, the reds and the blues. That shows us that the lupus is attacking the tendon. So this told me that Betty's treatment was not adequate. Her lab showed that her complements were low, her anti-double-stranded DNA level was high, and so I added Benlysta to her regimen. She really responded incredibly. This all went into remission, and it completely went away, but unfortunately, she was left with the permanent destruction that had happened. But unfortunately, even though she was feeling markedly better, every once in a while, she would come back into my office feeling horrible. She would be depressed. She had anxiety. She had great difficulty sleeping at night, and she just had no energy, and she was gaining weight. Well, we would butt heads a lot, and I'm sure a lot of you probably done this with your own rheumatologist. And I would tell her, Betty, your lupus is doing amazing. Unfortunately, a lot of patients like yourself, they get very depressed because of what the lupus has done to them, causing difficulty sleeping at night and other problems. And I really recommend we put you on an antidepressant, and I need you to exercise regularly. Well, she hated hearing this. She thought that I should be able to give her another medicine for her lupus and make her miraculously better. Well, one time we got in such a confrontation that she just got very angry and just stormed out of the office. So I wrote her a letter and I said, Betty, I really love having you as my patient, but it probably is better if you see another rheumatologist and get another opinion. Well, about 6 months later, I received a phone call from Betty, and she pleaded to come back to my office and see me again. So I saw Betty again, and this is what she looked like. Betty took my advice. She finally took her antidepressant. She started exercising rigorously, even though she felt horrible, and she started to feel amazing. And I'd like everybody to think about that. Most of us, during at some point in our life, have decided that we would exercise and eat well, and just think about those times and how great you felt. That's what happens when we, live a good lifestyle, and it does happen, but it can just be so hard to motivate yourself to do that when that does occur. But anyways, Betty did fantastic, and she came back to my practice, and she's just been a lovely patient ever since then and has been in remission since then. And I'm going to come back at the end of my talk and tell you how she's doing today. So let's talk about fatigue and lupus. That's one of the worst things that happens to our lupus patients, just like it did to Betty. It can be either due to the lupus itself and Benlysta removed her fatigue at first, but then sometimes our patients can get depression and other problems, and we have to use other therapies. But when lupus itself causes fatigue because of all the inflammation, we do have lupus therapies that do help. Hydroxychloroquine or Plaquenil is one of them. I have lots of patients who came to me with active lupus, put them on their hydroxychloroquine, and then just do amazing, go into remission, and their fatigue go away. Other therapies that have been shown to be helpful are belimumab or Benlysta, just like my patient Betty. The newest one on the block is anifrolumab or Safnello. It recently published a paper showing how it helps out with fatigue in many patients. Steroids does help initially, but we like to say that the P in prednisone stands for poison. We do not like to use steroids to help with fatigue. It does help out initially, but it causes organ damage in the long run. Someone submitted a question before the program asking if steroids causes diabetes. It absolutely does. Steroids can cause osteoporotic fractures, avascular necrosis, heart attacks, and strokes. The list goes on and on. We have to use therapies to get our patients completely off of steroids because they're horrible in the long run. DHEA. Most patients with lupus are deficient in this particular hormone, and there are some studies that suggest that patients with active lupus may have improvements in their energy if they supplement themselves with DHEA, which is an over-the-counter supplement. However, it can cause acne, it can cause increased hair growth in areas that you don't want it to occur, and it's also best to get it from a compounding pharmacist rather than over-the-counter. If you're interested in trying DHEA, talk to your rheumatologist. Don't take it on your own because it's not for everybody and it certainly does not help everyone, but it might possibly help some patients. And then vitamin D. Did you know that vitamin D is one of the most important drugs for treating lupus patients? Most of you watching this are not taking your vitamin D regularly. I know that because that happens to my patients and they do worse. I can measure their levels. I know when they're not taking it, but when they take it religiously, it does help. We want to get those levels to 40 to 80. That's our goal, and it can help out with disease control as well. So systemic lupus drugs, they only work if the lupus is active with inflammation and if that's the cause of the fatigue. So how do we know if someone is having active systemic lupus? Number one is by history. If patients are telling me that they're having mouth sores, if they're getting a rash when they go out into the sun. On physical examination, I'm looking for active rashes, ulcers in the mouth, see if there's inflammation in their joints. I'll use the ultrasound machine to see if the joints are inflamed as well, but the labs can also be helpful. Laboratory tests that we're looking for, and these are why we measure these labs on you, by the way, a high sedimentation rate, abbreviated as ESR, the C-reactive protein, the IgG immunoglobulin, anti-double-stranded DNA will oftentimes be high when lupus is active. There's a test called EC4D by Exogen. It's one of the AVISE tests. Not all rheumatologists order it. I wish everyone did because it's a much better test than looking for C3 and C4 complement levels. Anti-C1Q, that can be high as well with active lupus disease. Other things we're looking for are low complement levels. Lupus is a disease where it consumes complement, and these levels go down. These are only helpful in 1 out of every 5 patients. That's why I like to do this EC4D test that I just mentioned. It's a type of complement activation product from Exogen or AVISE that's much more commonly helpful in our patients. But nonetheless, 20% of our patients, we can look for low CH50, low C3, or low C4. So if any of these that I just mentioned are abnormal, then that suggests to me that that patient's lupus may be active in addition to what I see on the history and physical exam. That's when I'll use the drugs like Benlysta or Safnello or the other drugs that I mentioned to see if it could possibly help. But also, lupus can be active with completely normal labs. And that's important for everyone to realize. And unfortunately, not all lupus experts know this. They'll see all the labs normal and tell a lupus patient that, no, your fatigue can't be due to your lupus. But, there's no lab test to look for that correlates with the inflammation of the skin, lupus, for example. There's no lab test that 100% goes with active inflammatory arthritis, for example. All of these can be active and have completely normal labs. We need much better lab tests to figure out how to treat better, take better care of lupus patients, and hopefully we'll find better tests in the future. So this is an important point for everyone to realize. There's also the problem that someone can have active lupus and horrible fatigue, but the fatigue not be due to the lupus whatsoever. In fact, did you know that most lupus patients, even when their lupus is active, their fatigue is not due to the lupus at all, but it's due to something else, just like in my patient, Betty. Whenever a patient has fatigue, the first question I ask them is, how much sleep are you getting at night? If you go out on the streets of America and just do a poll on people walking on the streets and ask them if they're having tiredness or fatigued and how much sleep they're having, most will be tired and most are not getting 7 to 8 hours of sleep at night. But if they learn to get that adequate sleep at night, it can make a huge difference. I used to be a night owl. I love to stay up at night watching my reality shows, vegging in front of the TV. Then getting only 5 hours of sleep, I feel horrible the next day. But if I force myself to go to bed at 10 o'clock at night and get up in the morning at 8 o'clock or 7 o'clock, I feel so much better. So learning to get a full night's sleep is very important. Fibromyalgia is a problem where the pain nerves of the body are overactive overall, and also causes fatigue. Most of our patients actually have depression and anxiety, which contributes to fatigue. Sleep disorders. Did you know that sleep apnea is more common in lupus patients than the general population? Most of you are women who are watching this, and sleep apnea is underdiagnosed in women. So if you have horrible fatigue and you can't figure out why, ask your doctor for a sleep study to help figure it out. And then deconditioning, which means not exercising regularly and then getting problems with your cardiovascular system and your muscles being weaker, that also contributes to fatigue. So we have to look for these things and treat them as well. So for sleep, we recommend sleep hygiene. You can go to my website, lupusencyclopedia.com, and just go to the lupus secrets. And at the bottom, I have a link for where you can learn how to do sleep hygiene techniques. But the number one recommendation by sleep experts is something called cognitive behavioral therapy for insomnia. If you have troubles with insomnia, please write that down and Google it. You can actually find courses online for cognitive behavioral therapy for insomnia. Do yourself a favor and participate in one of those so you can learn how to get a better night's sleep. And then exercise. Exercise actually helps to restore the sleep cycle. Fibromyalgia, the treatment of choice is, again, exercise. But also we do have medications like pregabalin, which is Lyrica, Cymbalta, which is duloxetine, and Savella. All of those are FDA approved to treat fibromyalgia patients. Unfortunately, they're not very good in most patients. Exercise actually helps many more patients than the medications do. We have a huge unmet need for finding better therapies for fibromyalgia. Depression and anxiety. Exercise, again, is very important and one of the treatments, but also antidepressants. This is what my patient Betty did. She started to force herself to exercise. She took her antidepressant that I prescribed for her, and she really had a remarkable turnaround by just doing that. Again, ask your doctor for a sleep study because therapies such as a CPAP machine might be necessary, and it can really make a huge difference in people's quality of life if they have their sleep disorder treated. There's a lot of other ones, by the way, such as narcolepsy, and all of these have different treatments that are important for restoring people's energy levels. And then deconditioning, exercise is the treatment of choice. And I hope that you're noticing a pattern here, by the way. Exercise is helpful for the vast majority of these things, to include helping with lupus inflammation. And I'll show you a study that proves that, by the way. So other therapies that have been shown to help with lupus fatigue, weight loss. In fact, calorie restriction has been shown to be helpful. For the past 5 years, I've been doing something called intermittent fasting. I gained 40 pounds and I failed every single diet under the sun. I still can't follow any diet, but I've stumbled on this thing called intermittent fasting. I don't eat or drink anything until 3 o'clock in the afternoon, and then I stop at 10 o'clock at night. Eat or drink nothing else in the rest of the time except for water. I love, for example, I love hint water, and I drink black coffee, Stoke coffee, and then I won't eat today until about 3 o'clock p.m. I lost that 40 pounds. But the amazing thing is my energy is fantastic. I also force myself to exercise. So if you never tried intermittent fasting for weight loss, consider it. But if you have diabetes, please ask your doctor first. So drugs can occasionally cause fatigue, and that's important to keep in mind. Some blood pressure medicines, antidepressants, antihistamines, and so forth. But if a drug causes fatigue, it causes it soon after stopping the drug. I'm very active on social media, like the subreddit for lupus. In fact, if you're not a member of Reddit, consider it. It's a great forum where people learn off of each other. But it's amazing how often I'll see threads from people saying, oh, I'm having this horrible side effect from hydroxychloroquine for the past 2 months. What should I do about it? Please don't do that. We don't want our patients to have any side effects. If you get a side effect from any drug, please let your doctor know right away, because we can come up with ways to get around it. So for example, we oftentimes will go down on the dose of the drug, or stop the drug and then reintroduce it at a small dose and go up slowly, or just replace it with something else. So if you notice that a drug causes fatigue, let your doctor know right away so you can figure out alternatives. Use that patient portal. Most of us doctors use the patient portals these days. It's a great way to get information to us quickly, so we can talk to you quickly through the portal and give you some recommendations. So what is the #1 treatment of fatigue and lupus? Well, the #1 treatment, and there's every study that has ever looked at this therapy has shown that it works in most patients. And this treatment is exercise. And most people don't like to hear that, because when you feel horrible and fatigued and don't have any energy, the last thing you want to do is to start running on a treadmill or doing bicycling. But you know, it works. My patient Betty, she had to force herself to learn how to do this on her own. So the National Institutes of Health, they asked the question, well, why in the heck does exercise work in every single study in our lupus patients? So a few years ago, they started a study. They asked me if I would have some of my patients come and participate in the study. It's an exercise study in lupus patients. And they finally got 16 motivated patients. These were sedentary patients, by the way, with active lupus who didn't exercise regularly. And they forced them to do a treadmill vigorously until exhausted for at least 30 minutes, 3 days a week. Now, keep in mind, these are very motivated patients. Just like my patient Betty, at some point, she motivated herself to do this. I know these are motivated patients, by the way, because they go through the Washington, D.C. traffic and then show up at the National Institutes of Health and then go through that very difficult security situation and then jump on a treadmill and exercise. That takes a lot of motivation, but nonetheless, they did it. And let's see what the results showed. #1, the time to reach their anaerobic threshold improved by 93 seconds. And now what that means is that when we exercise on a treadmill, we're using something called aerobic exercise, where our body uses up oxygen. But at some point, the oxygen is consumed and our body has to switch to a different type of metabolism called anaerobic metabolism. And as people exercise more, it takes longer to get to that point. So this shows that their exercise ability improved. But what was really helpful for these patients and what they really wanted is that their fatigue improved. The patients had more energy at the end of the study, and they looked at something called the fatigue severity scale, and it decreased by 1.4. At the end of these numbers, you'll see something called the P less than something. For those of you who are into science and medicine and research, I put that on there for you. We call this the P value. And in order for a study to prove that it does something and proves that that result is actually not just due to chance, we want to see this P value reach a level of 0.05 or lower. These are fantastic p-values. And the reason this is important is because 16 patients is not very many patients. And we want to make sure that these results are not just by accident or by chance. And this shows that they were not done by chance. These are real results. Another thing that improved in the study is something called the 10-minute walk test. Before exercising, they would have the patients walk as fast as they could for as far as they could for 10 minutes. And at the end of the study, they had an average increase of walking 92 yards in 10 minutes. Now, I don't know about you, but I am horrible with distances. I have to have something to compare it to. So what is 92 yards? Well, the Statue of Liberty, from the pedestal to the very top of her torch, is 101 yards. So this is like someone walking an additional amount from the bottom of the pedestal to the bottom of her torch. That's a lot of distance in 10 minutes. But some more fascinating stuff to me as a rheumatologist and the National Institutes of Health lupus experts was a couple of other things. And one of these was something called the interferon gene signature. The interferon gene signature is something where there's a cytokine called interferon that stimulates white blood cells to become more overactive. And 80% of our lupus patients have very high levels of interferon gene signature in their blood. And those of you who are on Safnello or have heard of Safnello, this is how Safnello works. Safnello decreases interferon gene signatures, and it helps lupus through that way. Well, the NIH doctors, they tested this in these lupus patients. At the end of the study, 9 of these patients had significantly lower levels of interferon gene signature, and they had low p-values. Just think about that. Exercise did about as good as a drug called Safnello to help with their lupus inflammation. I find that fascinating. They also looked at something called the mitochondria, and that's a big selling point of this talk, is because we're going to talk a lot about mitochondria. Mitochondria is also known as the powerhouse of the cell. We cannot live without mitochondria. Every single cell, like a muscle cell, has to have a lot of mitochondria in it in order to give that cell energy to be alive. If it doesn't have this, it dies. And this is what mitochondria look like. So throughout the talk, you're going to see these oval structures with squiggly lines in it, and that's the mitochondria. But the mitochondria, they make something called ATP. Just think of ATP as energy. So mitochondria are essential for making energy. But unfortunately, mitochondria can get old, and they can start to become dysfunctional and stop making healthy ATP. And unfortunately, multiple studies have shown that lupus patients have high amounts of abnormal mitochondria. So the NIH doctors, they decided to measure mitochondrial function in these patients. They looked at something called the oxygen consumption rate over the extracellular acidification rate ratio. A lot of big words. Bottom line, that this is a way to measure mitochondrial function. And what did it show? At the end of the study, this mitochondrial function improved significantly. Just think about that. Only 16 patients, and the p-value was much better than 0.05. So I just found that this whole thing was very interesting. This NIH study that only used exercise for treatment, these patients had increased energy levels, These patients were able to exercise a lot better and get a lot farther with how they could do. Their immune systems improved, their interferon gene signatures improved, and their mitochondria improved. And I just thought this was fascinating. And that's what led to us to give this talk today. Lupus LA reached out to me and asked me if I would talk about mitochondria and fatigue to lupus patients. And so let's get started talking about that, because it is very fascinating. But first, let's talk about mitochondria. I know that most of you were not biology majors. I loved biology. That was my major, because I just thought it was fascinating. I love animals and plants and everything that has to do with that. But every cell of the body actually has organs in it called organelles. Just like we as a human being, we have a lot of organs like our heart, our brain, our muscles. Each of these is essential for us to live. Well, every cell of the body has its own set of organs called organelles, and one of those is the mitochondria. And the mitochondria, when you're talking about one mitochondria, we call it a mitochondrion. But when we talk about a whole bunch of mitochondria, it's mitochondria. Every cell of the body, whenever you see a picture or an image about mitochondria in a cell, you'll usually see just a few mitochondria in there. But did you know that every cell of the body has thousands of mitochondria? They're essential for producing energy. So this is how it works. And this is what you would learn in biochemistry if you ever took biochemistry and learned about the Krebs cycle and things like that. And I am not going to bore you with all of that, because I know most of you are not into biochemistry, but let's simplify it. So this is what a mitochondrion looks like. And the mitochondrion, it absorbs oxygen and glucose. So we have to eat, we have to breathe in oxygen to live. And what do those do for us? Well, they go into the cell and then they go into the mitochondria so it can do its magic. And the mitochondria, and it produces carbon dioxide, a whole bunch of energy called ATP, and then also water. We breathe out the carbon dioxide so it can go to plants, and the plants can produce more oxygen so that we can breathe it in and continue to live a good life. But unfortunately, mitochondria, through this process, also produce something called dangerous reactive oxygen species. And in my talk, you'll see ROS, reactive oxygen species. Just think of those as toxins, dangerous things. Free radical, oxygen-free radicals is another term for them, if you ever heard about that. Have you ever heard about taking an antioxidant to help with your body and detoxify it? This is what it's targeting, is these reactive oxygen species. Fortunately, our body is very elegant at getting rid of this reactive oxygen species and keeping us healthy, but sometimes the body becomes inefficient. The mitochondrion can produce too much of these reactive oxygen species, then it's dangerous for our cells. These free radicals or dangerous oxygen species can end up causing something called oxidation. Oxidation damages the parts of our cells. You know, oxygen is good. Oxygen going into the mitochondria to make energy is good, but oxidation itself is bad. Just think about iron. Iron, when it becomes oxidized, what happens? Well, we get rust, this ugly looking rust. Oxidation is bad. And when oxidation occurs in cells, the cells, they develop something called oxidative stress, and they die, something called necrosis. And necrosis is bad in lupus. And let's talk about that. So this is what happens with necrosis in our bodies. So we start off with a normal cell like you see on the top here. You can get swelling of the organelles and damage like the mitochondria. Let's say that the body is not taking care of them too much, or lupus patients have too many of these bad mitochondria. And then that cell can actually become damaged. And then what happens is that when it goes through necrosis, the cell membrane splits open, and then the internal contents are released into the blood and the lymphatic system. Well, just think about that. These are proteins from the nucleus. This is the person's DNA being released into the body. And people like myself, our body just clears it up very easily. But in the person with lupus, just think about that. You have anti-nuclear antibody. anti-DNA, anti-SSA. And those autoantibodies that are part of your lupus, they're looking at these parts of your own cell and they think that they're foreign invaders. They combine with it, forming something called immune complexes. They cause inflammation. They go to the kidneys and cause inflammation. They go to the skin and cause the rashes, to the mouth and cause oral ulcers, to the joints and cause joint inflammation and arthritis, because they think that this is foreign invaders. Necrosis is bad in lupus. What we want is something called apoptosis. Our body is very elegant that every cell of our body, or most of the cells, we start off with young, healthy cells, like a young, healthy T cell, which is a white blood cell, for example. But at some point, that T cell becomes old, it starts to become dysfunctional. And just like in society, old doctors will be replaced by young, healthy doctors. The same thing happens in our body. The body goes through something called apoptosis, which is cell recycling. And it's a very elegant way where the body recognizes that cells are getting older. It wants to turn those into newer, young, healthy cells. And so it breaks up those cells into something called apoptotic bodies. And then it actually recycles those inner contents. And the lupus patient's antibodies cannot see that. And so it protects it from the lupus immune system. And so this is what we want to see happen in lupus patients, and not necrosis of the cell. So we want that apoptosis. We don't want necrosis. But the problem in lupus patients is that they have too much of sick, dysfunctional mitochondria, which builds up in the cells, and that can cause necrosis. Just like apoptosis is important for recycling older cells into young, healthy cells, the way that we recycle mitochondria is something called mitophagy. And I put this in here for those of you who like science and research and biology. But the rest of you, if you're not interested in biology, you don't have to really understand this, but just know it's a way to recycle mitochondria. But mitophagy, think of it as the apoptosis of mitochondria to keep the cell healthy. We want to remove those bad, sick mitochondria and turn them into young, healthy mitochondria. And the body does that by absorbing these into lysosomes in the cell, and then it dissolves in and then can recycle them and make good, healthy mitochondria instead, so the cell doesn't become sick. And then this neatly recycles those damaged mitochondria so that cell stays healthy. But in lupus patients, there's a problem. That mitophagy is decreased in lupus patients, and this actually leads to necrosis of too many cells. We've seen this with neutrophils. We've seen this with T helper cells that are really important for lupus patients, and all other kinds of cells. And then just think about that. Those cells, they go through necrosis, they release their contents, your autoantibodies bind to them, and then that's what makes your lupus more active. So healthy mitochondria are important, but they're abnormal in lupus patients. And why does this happen, by the way? Well, we don't know. There's still a lot of research going on with looking into this. If we can figure out why this happens, it could potentially lead to better therapies for lupus and hopefully someday a cure. Lupus is genetic. Everyone was born with the genes that can cause it, but here we have this overactive immune system. We have abnormal mitochondria. We need to figure out how to stop these things in the first place. But there are ways we can treat our patients and get most of our patients into remission, just like my patient Betty. So in systemic lupus treatments, we want to stop this excessive necrosis. And we already have therapies that do this, by the way. I hope that every single one of you watching this right now are using one of these drugs for lupus. And what is that drug? Ultraviolet light protection. I get skin cancer. And so because of that, I have sunscreen on right now because my light above here is giving off UV light. It's contacting my skin. It causes necrosis of the skin cells underneath it. And then that's what can cause damage to the DNA and increase my risk of cancer. So I wear my sunscreen religiously. You as a lupus patient should be doing exactly the same thing. You should be wearing sunscreen even if you don't go outside because of that necrosis. or just put LED light bulbs in your house, and then you don't have to worry about that, at least when you're home. But this is one of the treatments for decreasing excessive necrosis and increased lupus disease inflammation. But something else that we can use are antioxidants. And by the way, for the rest of the talk, I'm going to be talking a lot about how we can help decrease oxidation, help increase mitochondrial function in the body of lupus patients. None of these are proven beyond a shadow of a doubt that they help lupus patients, but there is definitely growing evidence. And many of these therapies are incredibly safe. So I do think that these are good things for patients to use to help themselves. But I'm not telling you that these are treatments that can be used instead of hydroxychloroquine or Benlysta. Please take all your other therapies, but these might be beneficial in addition to that. So this is a nice diagram that shows what happens with antioxidants and how they might help out mitochondria. So here we have a mitochondria in the figure here. This mitochondria, like we talked about before, makes these too much reactive oxygen species or free radicals, and this is what can cause necrosis of the cell. Well, we can add antioxidants. These antioxidants, the problem with these free radicals is that they're missing electrons, and so antioxidants, they actually deliver extra electrons to those free radicals to help make them healthier. And this is the theory on how antioxidants may help out with decreasing mitochondrial dysfunction and helping out our bodies and decreasing necrosis in people who have mitochondrial problems. And so we're going to talk about antioxidants through the rest of the talk. One of those is a supplement that you can easily get over the counter called N-acetylcysteine, or NAC. It's an antioxidant, and we'll talk a lot more about that later. But the picture that I just showed you before is kind of how these antioxidants work. So I know I've talked about a lot so far, and we're going to talk about a lot more, but let me just give a quick sub-summary so we don't fall behind. So lupus patients have abnormal mitochondria. Mitophagy is abnormal. They're not able to get rid of those abnormal mitochondria very well. Those abnormal mitochondria build up. They make too much of this reactive oxygen species and free radicals. This causes cell necrosis, which is very bad for lupus patients because your anti-nuclear antibody thinks those are foreign invaders and causes inflammation throughout the body. Well, in 2016, the National Institutes of Health, they did another interesting study looking at abnormal mitochondria in a particular cell of the body called neutrophils. So let's look at how neutrophils work. Neutrophils are just a type of white blood cell. They're essential for fighting off bacteria, for example. And this slide here kind of shows some of the ways that neutrophils work. I'd like to focus on one of these. It's a very interesting concept, by the way. When neutrophils see bad bacteria in the body, one of the things they can do is that they can explode their inner contents out into the bloodstream and the lymphatic system, and it looks like nets, just like you see here, and we call it neptosis because of the net-like feature of those. And this is just like a fisherman throwing out his net into the waters to try to catch fish. Well, this is the same thing in the body. These nets from the neutrophils, they actually capture bacteria, and the bacteria stick to it, and then the neutrophil can swallow that bacteria and destroy it, something through a process called phagocytosis. But in lupus patients, this netosis can be dangerous if it happens too much of the time. The reason for that is that these nets, they contain the person's own DNA and SSA antigens and proteins, your anti-nuclear antigens as well. Then your ANAs, like anti-DNA, they think that this is a foreign invader again on these nets because your body's making too much of this netosis. This anti-DNA of yours, it binds to the DNA and it forms what we call immune complexes. And then these travel through your body and go to the kidneys and other organs where it causes lupus nephritis and other problems. So we need to figure out ways to decrease this abnormal netosis. Because in lupus patients, these neutrophils, and this is what a neutrophil looks like. You'll see a lot of, whenever you see a picture of it, this is how what it looks like. But just think about it, in lupus patients, they're not able to get rid of all of that abnormal mitochondria. And in 2016, the NIH actually showed this, and lupus patients, they have too much neptosis going on. It's overactive. Their anti-DNA binds to it and causes increased lupus disease activity. So what if we could improve mitochondria? If we can make more healthy mitochondria and less dysfunctional mitochondria, could we help lupus? Well, the answer is already yes. We saw this study, this 2002 study from the National Institutes of Health that showed that exercise can improve mitochondria. So there is more and more research going on suggesting that this is one way that we could potentially help out lupus patients. And the interesting thing is, many to most of these therapies do not suppress the immune system. That's why sunscreen is so important. It helps decrease necrosis of the cells of your skin, but it doesn't suppress the immune system. If you use that sunscreen religiously, you can decrease your need for immunosuppressants. The same with vitamin D. It doesn't suppress the immune system, but it can help reduce your need for immunosuppressants. So helping the mitochondria through therapies like exercise could possibly help as well. And then how about this supplement called NAC or N-acetylcysteine? This is what brought us here today because the Lupus LA was interested in this particular research study I'm going to talk about. Well, N-acetylcysteine, we'll just call it NAC for short. It's a lot easier to think about that way. Glutathione is a very important antioxidant. We need glutathione in the mitochondria to keep those oxygen radicals from forming and keep healthy mitochondria, but there's a lack of good glutathione in lupus mitochondria. So the question arose, well, what if we could give our patients extra glutathione? And one way to do that is that we need something called cysteine to be converted into glutathione in mitochondria. And this supplement called NAC does exactly that. It gives cysteine to the body so that our bodies can make more glutathione and help out with mitochondrial function and act as an antioxidant. Someone submitted a question, by the way, before the talk, and I'd like to answer that right now. They asked, well, why can't we just take glutathione? Won't that help lupus patients? That was a great question, by the way. Well, the problem with glutathione is it doesn't have very good what we call bioavailability. You can give it intravenously and it can be very helpful, but we can't give glutathione right now, and it hasn't been proven to help our lupus patients, so that just isn't very helpful. And the pills just were not absorbed very well. Well, some French scientists have come up with a better bioavailable glutathione. I understand that it is available, but it hasn't been studied yet in lupus patients. So I can't answer that question, but there is a lot of research on NAC instead. So this is just a list of research studies that have been done before the year 2023. Each of these studies showed by giving NAC to lupus patients and or lupus mice that their lupus improved. And so, and what I like to point out one of those studies, which is the bottom one by Dr. Lay and his associates, they took 36 patients with active systemic lupus. And the only thing that they did for those patients is that they treated them with NAC. They used doses anywhere from 1,200 milligrams a day, which is 1.2 grams, or 4,800 milligrams per day. Now, NAC comes in 600 milligram tablets, and so that's the same as taking 2 tablets at a time twice a day for the 1.2. But for the higher doses, that's like 3 tablets or 2 to 3 tablets at a day, 2 to 3 times a day. So it's a lot of tablets. NAC is also not absorbed very well, so you have to take a lot of it in order to be absorbed to help. And then they gave the patients this for 3 months. And what did the study show? First of all, the 1,200 milligram just didn't work. It takes high doses to do anything at all. But at the end of the study, what they showed is that those patients who took NAC at 2.4 to 4.8 grams per day, they had less disease activity, simply by taking this very safe supplement called NAC. They showed this by showing improvements in something called the SLEDAI and the BILAG. Those are both disease activity measurements that we research tools in lupus. For example, for Benlysta to prove that it was a good drug for lupus, it had to prove that it improved the SLEDAI score. Safnello wasn't FDA approved until it proved that it can improve the BILAG score. So just think about that. Here's a safe NAC that also did the same thing. But also the NAC treated patients, they had decreases in their anti-double-stranded DNA, which was good. They had increased apoptosis. Remember, I said we want apoptosis and not necrosis. And then it improved T cell populations. We need to have good T cells like T helper regulatory cells, which are decreased in our lupus patients. Well, this reversed that trend and actually increased the good T cell population. So very fascinating. But 36 patients is not very much. And the question was this too good to be true? This very safe supplement help our lupus patients? Well, in July, this paper was published where they looked at 80 lupus patients, 80 systemic lupus patients, and they did a double-blind randomized controlled trial, the very best type of study you can do. 40 of the patients were treated with 1,800 milligrams 3 times a day of NAC. The other 40 which were treated with placebo. And by the way, I want to point out something. If you look up this study, there was a typographical error in the abstract. The abstract actually said that these patients were given 1,800 milligrams per day. And I did the same thing, by the way. I just repeated this when I did a blog repetition and a Twitter about this study. But when you dive into the study and actually read about it, they actually got 1,800 milligrams 3 times a day. So it was that high dose that we're talking about earlier in these particular patients. And then they were given this for 3 months, and then they were compared to the placebo group. And what did it show? Again, the patient's disease activity improved. Their SLEDAI improved with a very good p-value, and so did the BILAG. And this is phenomenal. This is only in 40 patients in each subgroup. And so, with a small number of patients like that, that's pretty remarkable. So if this treatment is safe and it might help out with lupus, why not take it? It also showed immunological improvements as well. The CH50, remember I said that that's low when lupus, I'm sorry, this slide is incorrect, by the way. The CH50 actually increased, so I apologize for that. But it took patients who had low CH50 levels, and it showed that it increased at the end of the study, and it had a good p-value with it as well. Now, other immunologic markers also improved, but none of these were statistically significantly different, by the way. And again, that's probably has to do because there were so few patients in the study. 40 in each group is not a very big study, but there were numerical differences. Anti-DNA, we want to see it go down, and it did. C3 and C4 complement levels, we want to see them go up with better disease control, and they did. So it'll be fantastic to see an even larger study done. And right now, I understand that Dr. Pearl, who's up in New York, is doing that study at this moment, and so I can't wait to see the results. For those of you who love biology or researchers and want to really delve into mitochondria, I recommend you go online and download this paper. This paper is fascinating. It goes through all the research studies about mitochondria and lupus, how they're damaged, why they're damaged, how it contributes to abnormal lupus, but also it goes over the therapies for reversing these abnormalities. So just do a Google search for mitochondrial impairment and repair in systemic lupus, and then the doctor's name, Dr. Zhao, Z-H-A-O. And if you Google that, you'll easily find it, and you can actually download the entire paper and read it yourselves. And if this is a lot of information, by the way, Lupus LA is going to put this video up live permanently on Facebook, on YouTube, for example, so you can come back and watch this at a later time, and it'll also still be up on Facebook as well if you missed anything. Now, NAC is overall safe. Like the study I just mentioned, There were no side effects, zero side effects. But in other studies, there have been some what we call nuisance side effects. For example, in patients who took the 4,800 milligrams a day, in one of the studies, 1 out of every 3 did develop nausea. Other potential side effects are heartburn, headaches, allergic reactions, itchy rashes, and bruising. So the good thing is the vast majority of people don't get any of these, so that's important to keep in mind. Also, the vast majority of these are what we call dose-related side effects. So if you decide to take NAC, only with your doctor's approval, by the way, I'd recommend starting off at a low dose, like 600 milligram tablets. Start off like with 1 twice a day, and then slowly go up to 2 to 3 times at a day, up to 3 times a day. And just like they did in the studies, but no more than 4,800 milligrams per day. Then at any point, if you get any side effects, just simply go down on the dose to the previous dose that you tolerated. This is a common thing that I do with most of the medicines I use, by the way. It's a great way to make sure patients don't have side effects. So anyways, but it is important to point that out, that it's not a completely a side effect free type of supplement. It also has drug interactions. So this is important to keep in mind, and that's why you have to ask your doctor first. The only 2 drugs you should not take this with, by the way, are nitroglycerin and chloroquine. I would not recommend that in any patients taking those. Number one, it can potentially decrease the effectiveness of chloroquine. In patients who take chloroquine for the lupus, we don't want that to happen. Nitroglycerin can cause lightheadedness, so don't take it if you take nitroglycerin. Someone submitted a question before the talk. Does it interfere with hydroxychloroquine? It's very closely related to chloroquine, right? Well, the good news is that there have been no studies to show interference, and the vast majority of patients who were in those studies I just mentioned were taking hydroxychloroquine, so you can still take it together, it looks like. Blood thinners, it can potentially increase the risk of bleeding. If I have a patient on a blood thinner, if they're not at high risk for bleeding, then I would tell them, okay, it's okay for you to go ahead and take NAC, but just look out for the possibility of bleeding or increased bruising. If you develop that, just decrease your dose. But if I have a patient at high risk of bleeding, like someone who falls a lot or has bad balance, then I would recommend that they not take NAC if they're on a blood thinner. And then blood pressure drugs, I would just tell them to look out for the possibility of lightheadedness. If you get more lightheaded, please go down on the dose of your NAC. Bottom line is talk to your doctor first. So what other lupus therapies can help mitochondria? The paper that I just showed goes over these, and I'll just mention them very quickly. Metformin. Did you know that metformin has been shown to help lupus? First, it was in mice and rats with lupus, and then they did a small study in humans and showed that it actually decreased lupus disease activity. So in my new edition of the book, Lupus Encyclopedia, I include metformin as a possible therapy for lupus. It's not proven, by the way, but possible. If I have a patient with prediabetes, I urge them to go on metformin, but I won't use metformin if I have a patient who does not have prediabetes or diabetes. That's the FDA indication for using metformin in patients. But if you have prediabetes, why not? Ask your doctor to go on it and see if it helps your lupus. Other therapies that do help mitochondria: hydroxychloroquine, the drug of choice for lupus patients, chloroquine, and then also there's an immunosuppressant called sirolimus. Sirolimus is a drug that helps lupus patients, and it's underutilized. I have to admit that I don't use it probably as much as I should in my patients, but after this mitochondrial study came out, I think I'm going to start using it more often in my patients and see if it helps more of my patients with their lupus, because it also helps out with mitochondrial function. Now, coenzyme Q10, someone asked in one of the questions, can coenzyme Q10 help out with lupus patients? It is an antioxidant and might help out with mitochondrial function. There are no studies to show it helps out with lupus patients. The problem with coenzyme Q10, though, is that it doesn't dissolve into mitochondria very well. It doesn't get through the cell membrane or the organelle membrane very well. But there are a couple of over-the-counter analogs of coenzyme Q. One is called MitoQ, One is called idebenone. I don't know that one very well. Ibetadone. Even us doctors don't know how to pronounce names sometimes. Both of these are available over the counter. Dr. Mariana Kaplan, she's one of the world's expert lupus experts at the National Institutes of Health. She actually pointed this out to me. She was involved in the research with MitoQ. MitoQ was shown to be helpful in lupus patients in a couple of studies. Now, the downside of MitoQ is it is very expensive. So just keep that in mind. You can go on Amazon and buy it, but it is quite expensive. If I was a lupus patient and my doctor told me it was okay, I would probably do NAC, and I would only do MitoQ if I could afford it, and if NAC did not help out, but it might help. Other therapies that have been shown to help out with mitochondria and lupus, NAC, like I just mentioned, exercise showed to us by the National Institutes of Health, and then metformin can possibly help as well. Well, guess what? We're coming to the end of my talk, and then we're going to have time to answer any questions. So this is the recap. Unfortunately, fatigue is horrible in lupus. It's one of the biggest causes of horrible quality of life. And I know that most of you watching this are here today because of this problem with exercise. I hate to tell you, but exercise is the drug of choice for treating lupus fatigue, not only in lupus patients who have very active lupus, but also patients whose lupus is under very good control. Now, if fatigue is due to active lupus inflammation, there are some drugs that can potentially be helpful. And when I have a patient who has real active lupus, by the way, high anti-double-stranded DNA, low complements, horrible fatigue, I always try these therapies. This is one of the reasons why I use Benlysta, by the way, in my patient named Betty, because I've seen such great results in so many of my patients with these particular lab abnormalities. But hydroxychloroquine can help. Benlysta, Safnello, vitamin D absolutely as well. I do not use steroids in my patients for fatigue. It just has too many bad side effects. It causes organ damage. It actually decreases lifespans in our patients. And then DHEA may possibly be helpful. It's not proven, but if a patient asks me if they can try it, I do prescribe it for them, but I always send it to a compounding pharmacist and ask them to look out for the possibility of acne and increased hair growth in places that they don't want it. We usually have to treat problems like lack of sleep, deconditioning with exercise, fibromyalgia, depression, and I always recommend sleep studies to my patients because these are actually the most common causes of fatigue in our patients. And by the way, exercise helps most of these. So in lupus patients, they do have abnormal mitochondrial buildup. This increases the necrosis of cells in the body, which causes increased lupus disease activity and is associated with fatigue. So it's fascinating that therapies that could help out with improving mitochondrial function might help lupus patients. Some therapies that have been shown to be helpful include hydroxychloroquine. If you're not, by the way, 45% of you watching this are not taking your hydroxychloroquine religiously. Please start taking it. I checked drug levels on all of my patients. I found that almost half of them were not taking their hydroxychloroquine religiously, and I thought my patients were perfect. When they started taking it regularly, because I watched them like a hawk, most of them did markedly better. So please take that hydroxychloroquine. Metformin might be helpful in some patients. And then over the counter, you can actually get MitoQ. Ibetadone or NAC, but talk to your doctor first. If I was doing it, I would do NAC first, start off at a low dose, go up slowly, watch out for those drug interactions. But you know what? Exercise is a free drug. So that is actually the most important one on this whole thing because it has so many other benefits, by the way. Now, what are my top recommendations? Okay, I talked about a lot of stuff. It's too much to absorb, but I have to pick out just several things for you to take away as the following. Take that hydroxychloroquine religiously. Hydroxychloroquine has so many benefits. Did you know that it increases remission rates threefold? 3 times. When my patients who were not taking their hydroxychloroquine started taking it religiously, I had a lot of them go into remission simply by taking their hydroxychloroquine. Some of you who are watching this don't think you can take hydroxychloroquine because you had side effects to it. please go to my website, lupusencyclopedia.com. Join my email list so you can learn about new blogs as I put them out. But in the search bar, type in top tips. Hydroxychloroquine, and you'll find this research or this blog article I wrote called Top Tips on Taking Hydroxychloroquine. It gives a lot of tips on how to take hydroxychloroquine, even if you had side effects. But ask your doctor first. Even patients who have had bad rashes to it can potentially take it by doing something called desensitization. Patients who can't tolerate it because of their stomach or other problems, they can start off at a tiny dose and go up very slowly. For example, did you know that there's now 100 milligram tablets of hydroxychloroquine? You can get it through goodrx.com, and then just start off like a quarter of a tablet a day, slow, which is only 25 milligrams, and slowly increase your dose till you can find the maximum tolerable dose. So it gives lots of tricks like that. And so I hope some of you can take that away from this talk today. If you have prediabetes or diabetes, just remember the #1 cause of death of lupus patients are heart attacks and strokes. They happen 10 to 20 years earlier than they should. They take away too many of our lupus patients. So helping things like prediabetes and diabetes is important. Consider asking your doctor about metformin to help out, because it might also help out with your lupus. And then ask your doctor, is it safe for me to take NAC? But if you do, these are the recommended doses. Start off low, go up slow, and take the maximum dose that you can tolerate without side effects. But exercise is the most important treatment. My prescription for you for this is every week, do 150 minutes of moderate aerobic exercise, 2 to 3 days of strengthening exercises. The reason for that is that lupus causes something called sarcopenia, decreased muscles. That's one reason why our patients get obese. They're using less calories because they have smaller muscles. You need to build those muscles back up, and then make sure to stretch before and after. Now, many of you are saying, well, I am too tired. I hurt too much to exercise. And I totally understand that. That's how my patient Betty was. What I recommend for you and what I do with my patients is I send them to a physical therapist. I ask the physical therapist to formally evaluate their physical function, their kinetics, their biokinetics, and then to design a safe exercise regimen for that patient, and start off very low and go up very slow. And every single one of you who are watching this can absolutely do that. Everyone can exercise. And then exercise, and then always remind yourself, when you find yourself being lazy, remind yourself that exercise is as important to living as eating and sleeping. When I find myself being lazy, this is what I tell myself. So I'd like all of us to say it right now. Exercise is as important to living as eating and sleeping. So remember my patient Betty. She has horrible lupus. It destroyed her joints. I wish we would have had better therapies like Benlysta way back when she first developed it in the 1990s. That's when she got it. If your doctor, by the way, is recommending therapies for you like Benlysta and you just want to stay on prednisone, please don't do that. We have much better therapies. I could have kept this from happening from Betty if she were a new patient today. But Betty, even today, even though she went into remission with adding Benlysta, even though her joints are not getting any more deformed, and even though she took her antidepressant and exercised religiously, every once in a while she goes off on the edge. She gets through stress. Life happens to all of us. Family gets difficult. She moved to West Virginia, for example, which was very hard for her because now she has to travel so far to come to me. So every once in a while she stops exercising, gains some weight, and then this is what she looks like. But today our conversations are very different. Today she doesn't fight with me when I recommend to her to exercise. She always says, Dr. Thomas, I know what I need to do. I need to start exercising and eating right again. I just need to motivate myself. And then she does. And when she comes back, this is what she looks like. So I hope that everyone watching this today could take out some very good tips and tricks. Do yourself a favor. Don't watch this and say, oh, those are a lot of great recommendations from Dr. Thomas and I should do them. No, don't do that whatsoever. Make a commitment. Make a commitment to start exercising regularly. Take your hydroxychloroquine and your vitamin D. Use that sunscreen religiously every day. Do put those healthy life habits into place. Consider taking NAC with the advice of your doctor. Because if you do these things, I promise you that you can learn to conquer lupus and not let lupus conquer you. And now I'm open to answer any questions that anyone might have. And Brianna, if you have any questions, I'm open to answer them. And someone's going to win a copy of my book.
Yes, they are. Thank you so much, Dr. Thomas. That was such an important topic, and you covered so much ground with the practical tips. So thank you so much. Let's get into some of our questions coming in from you guys in the community. Just a quick reminder for everybody, we're going to announce the giveaway winner of our book giveaway, the Lupus Encyclopedia, at the end of this Q&A. So if you entered to win, stay tuned. And then also, Dr. Thomas was kind enough to give away a second copy to an attendee today. So we'll share the details about how to enter at the end of this Q&A for that as well. So let's see what we've got here for you. Angelina asks, for vitamin D supplements, what do you recommend? Do you recommend vitamin D3?
That's a fantastic question. There's a lot of misinformation, Brianna, on the internet. You'll find lots of blog articles saying vitamin D3 is the best. Don't take vitamin D2. Vitamin D3 is over the counter. Vitamin D2 is that weekly one we prescribe for you. They work both just as good as each other. The big difference is that vitamin D3 is absorbed a lot easier, so we can get away with lower doses of vitamin D. For example, vitamin D3, 2,000 international units a day versus 50,000 once a week of vitamin D2. But they're both converted to the active form of vitamin D that goes into the white blood cells, attaches to those receptors that make the white blood cells work better. There's been several great studies showing that vitamin D decreases disease activity in lupus. One of them by Michelle Petrie, she actually used both types. One of them that was a randomized controlled trial in children with lupus and showed benefits. They used the prescription one. And then there was one from Spain where they used the over-the-counter vitamin D3. All of them worked. It's very easy to do. I just check their vitamin D level every 3 months. My goal is to get it between 40 and 80, and that's the magic number. I can do it with any vitamin D.
Perfect. Thank you so much. We have a question from Hyam. What about anemia tied to SLE related to exercise? What do you recommend in those situations?
Sure. First of all, anemia means decreased red blood cells, and we diagnose it by decreased hemoglobin on the blood test. Many lupus patients have anemia because, number one, most of our patients are women of reproductive age. They're menstruating every month. They have iron deficiency. That's the most common cause of anemia in our patients. We treat it with iron. But there's a lot of different causes of anemia. Anemia, you don't treat all of it with iron because it only helps iron deficiency anemia. Low vitamin B12 can do it. Lupus can attack the red blood cells, something called autoimmune hemolytic anemia. We have to treat it with immunosuppressants. So we always have to figure out the cause of the anemia before we know how to treat it. With mild anemia, exercise, you don't have to worry about it whatsoever. If the hemoglobin is around 10 or higher, there's no restrictions whatsoever in the vast majority of our patients. If it's lower than that, then just talk to your doctor on what they recommend as a safe exercise regimen for you.
Got it. Perfect. We have another question here. Does NAC affect your hormones?
That I have to plead ignorance about that. I really don't know. The studies with NAC are pretty new in lupus, and it's not something that's researched nearly as much as others. And I'm definitely not an expert with NAC. So, and I'm also not an expert with mitochondria, by the way. When I read those research studies, me as a rheumatologist, it was some tough reading. But I don't know the answer to that. But good question. I'm not sure.
No problem at all. Thank you. The next question you did cover a little bit, but if you have any extra advice here, this is a concern that we hear really often in the community, which makes complete sense. Coming in from Kelsey, how are you meant to motivate yourself to exercise when you have severe lupus fatigue and likely depression as well? It's good that exercise helps, but there needs to be something other than just do it. Do you have any additional advice there?
Oh boy, I truly wish I had the answer to that, because I go through the same thing, by the way. I try to exercise regularly, but every once in a while stress will hit me. I'm a doctor. A patient will die. I'll work more than 12 hours a day, and I stop exercising and feel horrible. And when I do, it's hard for me to motivate myself. So even for myself, I don't know the magic answer, except I do say that mantra to myself about exercise is as important to living as eating and sleeping. What I recommend doing is learning from other patients. So that I mentioned a forum called Reddit, reddit.com. They have a great lupus subreddit. Great place to bounce these things off of other patients, saying, what helped you motivate yourself to exercise? I think that's the best way to answer this question. But the other one is with the physical therapy referral. I absolutely am a strong believer in that, because physical therapists are the experts in the medical field when it comes to exercise. They're faced with this problem all the time. They probably have much better answers for this than I do. So those are my two biggest, my three biggest answers. Is one is my mantra that I say, join Reddit or another online forum and learn from others. And then number three is to get a physical therapy referral, get some professional help. It's a great question.
It was a great answer. I thought that mantra was excellent. So I'm really glad that you shared it. Really, really powerful. I also just want to add to anyone who's listening, along those lines of learning from other patients. There are so many great stories from patients about what's worked for them in similar situations to you. And if you attend any of the virtual Lupus LA support groups, which I'll link to in the comments, or our private Facebook group at facebook.com/lupusla/groups, you can add that as well, and join into the conversation there for private communication with other patients to get feedback from them as well.
Brianna, I'm so glad you mentioned that. That's the whole reason why I showed the slide with Lupus LA at the end. Lupus LA is wonderful, everyone. Please join Lupus LA, and they do have some fantastic support groups. So thanks for mentioning that, Brianna.
Thank you, Dr. Thomas. I just have a couple quick more questions. We'll try to move through these quickly. Crystal asks, I do know that for some people, too much cardio isn't good because it can use too much energy, and people suggest strength training instead. Is that right for us?
Well, it's a combination of both, actually. And you're absolutely right that doing too much cardio above your physical abilities, that isn't good. And so that's why I think that the physical therapy referral to learn how to do it safely is a good recommendation. And part of it is because not having enough muscle mass. Most patients with lupus are obese. Most patients with lupus have decreased muscle mass, something called, it's called sarcopenia. And it's not your fault, by the way. It's because the steroids actually eat up muscle and make fat. I mean, that's horrible. Also, the pain and the fatigue itself automatically makes you not move around as much. You lose muscle because of that. You increase fat mass. And so that's why you have to build up that muscle strength. It does take a combination. So I'm glad that this questioner brought that up. And if you're unsure how to do finding that magic balance is very, very important. And always getting a physical therapy help can be helpful.
Perfect. And I think we have one more question on supplement related items. So TL Wagner asked, when we exercise, is it safe for us to use arnica for muscle aches? Are you familiar with the supplement use in lupus, Dr. Thomas?
I am totally ignorant, so I'm sorry I can't answer the question. I wish I knew. I'll have to look it up.
No problem at all. Thank you so much for your time today. Again, such an important topic and topics, really. And this is the part of the session where we're going to announce the winner of the giveaway of your book, the Lupus Encyclopedia, the second edition. So our winner is Jerry with the handle Everyday Living Lupus. So Jerry, congratulations. We'll be reaching out to you for your information shortly. And then before we go, like we mentioned earlier, Dr. Thomas had generously offered to give a second viewer a free copy of his book, especially if you're not on Instagram, to enter to win a copy on his Facebook page. So the way that you would do that is if you attended the live session today, you'll go to Dr. Thomas's Facebook, which we'll link in the comments, and just comment on the last post of his page today. So all you have to do is comment on the most recent post today, and he will select a winner to receive a free copy tomorrow from those comments. Isn't that right, Dr. Thomas?
Yes, and I'm going to ship out the book to both of these winners. By the way, whoever wins, like Jerry, make sure to email me at lupusencyclopedia@gmail.com. Lupusencyclopedia@gmail.com, and then I'll ship you. You're going to send me your address, and I'll ship it to you. The same thing with whoever wins it on my page, and my Facebook page is Lupus Encyclopedia.
Perfect. Thank you so much for your time today, Dr. Thomas. This was awesome.
You're welcome, Brianna. Thanks so much for having me. And remember, knowledge is power. And I hope everybody learns to take even better care of your lupus. Everybody have a wonderful weekend.